want to take this opportunity to welcome everyone to be a part of this wonderful town hall gathering on the COVID-19 vaccine. There's so much information out there, most of it not good because we're getting it from the wrong places. And I've said before, you should trust medical experts and not social media professionals. So I would ask that you would write down some of the information that you're getting. We'll also be able to rebroadcast this, and we want to thank everyone who was participating today. You're going to hear a little bit more about everything, but we're excited about it. So we want to start off with a word of prayer, and then I'm going to introduce a wonderful sister who will take us from that point. Let us go to God in prayer at this moment. Gracious and most merciful God, in whom we live, move, and have our being, we give you thanks on this day. We ask, oh God, that your spirit would rest, that the expertise of medical professionals may triumph over the gossip over social media trolls, that our body is a gift, and the innovation explored by minds gifted to be able to examine nature, biology, and understand epidemiology is a gift from you. And so may you bless this gathering today. We give you thanks, we love you, and we magnify your holy name. In the mighty and wonderful name of Jesus, we pray. Amen.
Amen.
I would like for this time to introduce a wonderful sister who is right next to me. She is a graduate of Spelman College and also Columbia University Teachers College. She has a special gift around food justice. She's a food justice advocate and currently now the chair of the Greater Chicago Food Depository. She is the wonderful, phenomenal, fantastic, beautiful, incredible. She is my partner in life, love, and ministry, none other than Monica Moss.
Well, thank you. Wow. I guess I need to cook dinner tonight for this man. Thank you for that. That was very kind. And I just want to start by saying how grateful I am to all of you for taking time out of your Sunday afternoon to be with us for this most auspicious occasion. This is a time when we are going to get facts, not fiction. We have an amazing team of panelists who are here. They have the right information to give to you. And we also are so excited about having our moderator, our sister, Star Jones, who's going to lead us in a major discussion so that we can have the right information. We can be armed. When this pandemic hit, you would think that we would have immediately realized that one day there was a vaccine that would be coming and that we could start preparing ourselves and getting the right information out there. But I think that for our community, and there is a natural hesitancy that comes with anything new. This has been a scary time for all of us. So I do want to acknowledge that. But what I want us to leave with today is the information that you need so that you can make an informed decision, so that you can save your life. And so we are so excited about what we're about to do for the next hour or so as we have this time together. I also want to say we really, really miss you all. We really, really miss you and can't wait till we can be back in the church house together. And this is the type of thing that will get us there. So if we get our vaccinations, we will be able to get back together sooner than later. But right now, I want to take a moment to introduce someone who you all know. And she wants me to keep it short, but I really don't want to just do. I want to make sure you know exactly who she is. You think you know her, but I want you to know her from my perspective. So Star Jones is our moderator this afternoon, and this is major because she's a professional at this. She knows exactly what she's doing. She's an attorney. She's a former New York City homicide prosecutor. She's a business executive, and she's a best-selling author and an Emmy Award-nominated TV host who's worked on television for nearly 30 years. Amazing. So I also want you to know that since she came to Chicago a few years ago, she is now the co-founder and principal of an organization called Instant Impact Group. And this is important because this consultancy firm is assisting individuals and companies to build their diversity, equity, and inclusion programs. And you know how important that is right now. I also want you to know that you remember her from The View, but I also want you to know that she is a survivor of open heart surgery. And this surgery and the experience she's had with heart health has led her for the last 10 years to be an advocate and a national volunteer for the American Heart Association. That's near and dear to her heart, and she takes it very seriously. She also is a major fundraiser, and I have to lift this up because we know we now have a Black woman who's our VP. Kamala Harris is our VP, and Star Jones is one of the reasons that she had so much success because she raised so much money to get her in that office. Brown Girls Fundraising Collective is a private network of Black and Brown women who individually and together utilize their personal financial resources to support political candidates. And that's exactly what Star did for our sister, Kamala Harris. And so we're just excited. She has so many things I could also tell you about, but I want to tell you this too. When she moved to Chicago a few years ago, she and her husband, Ricardo Lugo, became members of Trinity United Church of Christ. And so, without any other hesitation and without any other ado, I want to introduce to all of you our moderator and church member, Ms. Star Jones. Thank you, Star.
Thank you, Sister Moss, Soror Monica. I want to tell you, you do not pay attention to instructions. I specifically told you not to be verbose when
I
it
know,
comes to introduction.
but I mean,
It's
I could do
so
that again. So,
it's
thank
so unnecessary. Pastor Moss and Mrs. Moss have been my brother and sisters literally since I arrived here in Chicago. My husband and son and I enjoy worshiping at Trinity so much, and so giving back to the Trinity community is part of my DNA now. You got me. There's no choice. So there's nothing that you can do. I love the Trinity community, and there's nothing that you can do about it. And so I am glad to be a part of today, especially since COVID has really devastated the Black and Brown community, which is obviously a community that I know and I love. So I appreciate your sisterly support, but I really want us to focus on why we are here today. Today's town hall aims to provide current, scientifically accurate, and expert analysis of the relevant issues surrounding the COVID 19 vaccine, to educate the Black community in hopes of assisting us all in making personally appropriate health decisions for ourselves, our families, and the communities in which we live. So, what does all that mean? Um, Pastor Moss said today, and he has said numerous times, we're not going to be focusing on what you heard at the barbershop or at the nail salon or what your cousin, I think you said Leroy, at church this morning, told you about it. We have some of the most gifted and talented medical experts who are part of our Trinity family now. And some go back for years and years, a part of the Trinity family, been baptized right there in the church, that are just the experts in this field. So when you want to know what's going on, we want to give you that information. And so it's my pleasure to introduce you to our esteemed panel for this afternoon. We have three medical professionals who will be joining us. First, Dr. Marlisi Arnett. Dr. Arnett is a board certified family medicine physician with a background in public health. She founded and leads bitewellness.com, a digital wellness support platform that empowers Black women across the country to prevent lifestyle related chronic diseases. She also works as a hospitalist physician for Northwestern Medicine. Dr. Arnett is proudly from the South Side of Chicago. After completing her undergraduate education at Princeton University, she completed her medical training at the University of Pennsylvania School of Medicine and the Northwestern Family Medicine Residency Program at Lake Forest Hospital. She also earned a master's in public health from the Johns Hopkins Bloomberg School of Public Health, where she published research on the effect of the medical mistrust on racial disparities in healthcare use. So, yeah, she can answer all those questions you have. Next, we will have my sister, Dr. Maya Green. Dr. Green is the Regional Medical Director for Howard Brown's Health South Region Clinics. Yes, she is large and in charge. After obtaining her MD, MPH with a focus on health policy and administration at the University of Illinois at Chicago, she completed a residency in family medicine at the University of Miami and a specialty fellowship in HIV medicine at Rush University Medical Center. Her client panels include pediatric, adolescent and adults who speak Spanish or American Sign Language, and people who experience substance use disorder. She previously worked as an HIV specialist at the Ruth M. Rothstein Core Center. Dr. Green is the founder of HIV Real Talk, NFP, and a board member of the Chicago Task Force Prevention and Community Services. Both of these organizations focus on decreasing disparities among Chicago's marginalized communities. And third, we have Brother Dr. Kareem Watson. Dr. Watson is a community health scientist who serves as the Associate Executive Director of the Miles Square Health Center, a group of federally qualified health clinics affiliated with the University of Illinois Hospital and Health Sciences System. He also serves as the Associate Director of Community Outreach and Engagement for the University of Illinois Cancer Center at UIC, and has a faculty appointment at the UIC School of Public Health and research assistant professor. His research is focused on cancer prevention and control and mitigating the impact of social determinants of health on chronic conditions such as diabetes and hypertension. Dr. Watson's research and publications are deeply rooted in community engagement and health equity and expanding diversity in clinical trials. What do all three of these brilliant experts have in common? They have been working in the community on health equity for many, many, many years, treating patients, doing research, teaching new doctors. So we have the people necessary to answer those questions that I know that you have on your mind. And so let's get started. Dr. Green, Dr. Watson, Dr. Arnett, welcome. Welcome to you all. I'm going to ask you to unmute yourselves. And let's just start out with the question that's on everybody's mind. And Dr. Maya, I'm going to start with you. Why should we trust the COVID vaccine, and how do we know it is safe to take?
Hey, I think, and I know we're going to get into it. It is a process, and so what we hear about, not only we label it medical mistrust, but it's really the lack of trustworthiness of the healthcare institution and industry historically, towards Black and Brown people. So there are a lot of reasons why, understandably, people have questions, and we're here to answer them. So why should we trust it? We should trust it because the science backs it. Not only the science, but we have now what I know, Ms. Jones, you mentioned before, Mrs. Jones, you mentioned before, we have Black and Brown people at the table creating, making decisions at the table doing research like Dr. Watson. And now, because we are at the table when these decisions are made, vaccines are developed, the implementation is developed, we have more reason to trust it. We're going to go through this panel today. I'm excited because I know that doesn't just say, hey, I said it, so you should trust it. We're going to present evidence. We're going to talk about it, hash it out, undig it, uncover all those layers and move forward. So excited to be here. Thank you for having me.
Thank you so much, Dr. Maya. Dr. Kareem, Dr. Maya mentioned your research. Why in the heck should we trust the COVID vaccine? How do we know it's safe to take? Sir, you the researcher.
Yes, thank you so much for that question. And one of the things we have to think about is that one of the things that I heard a lot about was the speed at which this vaccine was developed. Like the people say, well, Kareem, you tell us, you've talked to us in several town hall forums before about the phases of clinical trials, right? That there's a rigorous process that takes place. People don't just come up with an idea and then they get that data and they say, here you go, let's take this. No, there's a rigorous process. And what I want to dispel is that myth that the warp speed, when we have to be careful about using terms like warp speed, I think that did more damage than it did supporting this, because you hear the term warp speed and it rightfully so brings up a certain amount of caution, right? But there's a procedure we have in place through the FDA called Emergency Use Authorization, EUA. Emergency Use Authorization is not anything new as it relates to COVID-19. We are very fortunate in our government to have in place scientific processes that can help us in times of crisis. We are in a time of a crisis. As a result of that, when the SARS-2 COVID-19 pandemic began to come to surface, immediately the scientific community got its things together to say, how do we begin to develop research, including testing research as well as research for vaccines that can allow us to begin to mitigate this pandemic. So I want to uh, let the community know, I hear you. I did not like the term warp speed myself. I think that that framing of it just perpetuated some of the medical mistrust that exists. But what I do want to let you know is that please go look at some of the data. Later on in today's conversation, I'm actually going to talk about how many people were in the studies that took place, and let people know that those people that were in the trial looked a lot like we do. They had some of the same conditions that we have. But I do want to dispel this myth that warp speed meant no rigor. That is not the case. Warp speed is something that was out there, but one of the things is that this study was a part of the scientific rigor that exists through the FDA for a process called emergency use authorization.
Dr. Watson, it's wonderful that you helped dispel the fact that emergency use didn't just come last week. This is something that has been in place for some time now, depending on what is going on within the medical and scientific community. Dr. Arnett, I come to you with the same question, but putting it in the framework of you specifically focus a lot of your work as it relates to women in the community. And Black women, we know, are the hedge of protection for our family. So if mama ain't healthy, ain't nobody healthy. So why should the sisters say this is safe to take? Because they're going to be the ones impacting on their mates in the house and the children in the house. Dr. Arnett?
Yeah, I mean, I echo the sentiments of Dr. Green and Dr. Watson. So first, don't just take our word for it. We're going to present evidence, make up your own minds based on the science. And then second, this vaccine has been in development in some form for a number of years, actually. The science underpinning this vaccine, or mRNA vaccines, has been studied for 20-ish years. The science underpinning the creation of a vaccine for this SARS-CoV-2 virus that creates COVID-19 has been in the works for a number of years, since Middle Eastern respiratory syndrome affected the world. And so 5+ years ago, scientists began studying this other virus that's a cousin to the coronavirus that creates COVID. And so, there's a lot of background work that most of us weren't aware of. I wasn't aware of this until I started to read about it and hear interviews with the scientists that had been working on this information. So we are by no means suggesting that you take a vaccine that hasn't been well developed and hasn't been well studied. I agree with Dr. Watson. Warp speed is not necessarily the term I would have used. As for Black women, we know that we need to keep ourselves safe in order to keep pouring into our community, pouring into our families. And so we pull back and think about the greater picture, right? This is about keeping our community safe and making sure in so many ways that we're around for them. We're not doing this just for us. We're doing this for all of us.
Absolutely. Dr. Arnett, one of my very favorite things to recall when it comes to medicine is that instruction we all get when we are on that plane. We are ignoring the flight attendants for all practical purposes as we get our AirPods and stuff together. But that one phrase they say, in case of emergency, put your own mask on first before you start trying to assist others. This vaccine is something for you to put your own mask on first. And you all have answered my question surrounding some of the misinformation that's out there. So let's just get to some medical information. Dr. Green, we've heard numerous vaccines: Moderna, Pfizer, Johnson & Johnson, 1 shot, 2 shot, half a shot, shots, too many shots in the same vial. Which vaccine is the most effective? Because as the sisters that I talk to, they all say, Star, that's the one we want. Okay. So which vaccine is the most effective?
So when you look at the science, both vaccines that are available in the U.S., which are the Pfizer and Moderna, the Johnson & Johnson is coming, but both vaccines are available in the U.S., are 2-dose vaccines, and they are over 90%, over 95% effective. This does not, when we talk about efficacy, it's effective after this high efficacy is available after the second dose. So the first dose is a primer. You do have some level of immunity. You're going to need that second dose. So when you read it, it's not today, I got it. Ooh, I'm going outside and I'm going to do whatever I want to do. It's 95% effect, more than 95% effective after the second dose. And then you still have to wait 2 weeks before you get your full superpowers going on. And so whichever one you feel comfortable once we present this research doing, I do love Dr. Kizmikia Corbett. I just want to give a shout out to Dr. Kizzy because she was at the helm of creating Moderna. But not only does Dr. Corbett talk about Moderna, if you follow her, she's going around the country talking about Pfizer, Moderna. She'll give you information on Johnson and Johnson. This is a Black woman in leadership doing what needs to be done, creating life-sustaining vaccines for us, life-saving vaccines for us. So whichever one you have available, we're going to present research and resources about side effects and stuff like that. You choose, and then you move from there.
Well, okay, so Dr. Maya, I got a couple of questions from the sisters and brothers in the community. So they want to know, do you have a choice of which vaccine you are given? And if you don't want to receive one or the other, does that remove you off the list to receive the other one? So you already said Dr. Kizzy had something to do with the Moderna vaccine. So now I can hear everybody in the back going, all right, girl, I'm gonna get that Moderna. But if you're in line for the Pfizer, what happens?
So transparent, being transparent, I took the Moderna, I took the Dr. Kizzy special Moderna me, and so that's what I went for. Now, if Pfizer was available first, would I have taken it? I probably would have taken it. And do you have a choice? So there is a link also to the city of Chicago. And what I would do is ask my medical provider, or go to that link if you're not yet engaged with a specific medical provider. When you call these places, ask them which one. The city does offer both Pfizer and Moderna at different sites. Now, if my institution, for example, is only given Moderna, so if someone doesn't want Moderna and it wants another one, they have to go to the city and get linked. So we have to really work in our community to navigate the resources, but I'm going to provide those resources to you, Ms. Jones, if that's at the end of this, and people can click on that link and look for whichever one they want. Start now. Don't wait till you write one. Start now learning how to navigate that link.
Absolutely. You all get your papers and pads and your iPads and your iPhones ready. A little quick way, if she gives us something, we're going to make sure I repeat it again and again. And I'm going to ask the producers to put it in the chat so that we can make sure you have those resources. Dr. Arnett, listening to what Dr. Green just said, let's say once you receive that second vaccination, how long will it take to be effective against the virus? Because there is some confusion on that.
Yeah. So, I go by the protocol of the clinical trials. That's sort of the only factual information that we can trust. And so the efficacy of the vaccines, or the peak protection of the vaccines, was measured a week after the second dose. So that's when we expect to see peak protection. Now, I think we're going to get to this a little bit later, but there's some discussion about there being some level of protection, lesser protection, achieved after the first dose and before the second dose. But really, the only factual information we have on peak protection is after the second dose.
And actually, let's just go into this now. What are the implications of that 2-shot versus a 1-shot vaccine, and what is the impact if only 1 shot is received of a 2-shot vaccine? I think Dr. Green was starting to allude to that. So now, Dr. Arnett, why don't you start us off? And if anybody else wants to jump in, please feel free.
Yeah, so can't reiterate this strongly enough. If you take one of the mRNA vaccines, which are the only two available right now in the US, they're 2 shots. You got to finish your schedule. You have to finish your 2 shots. So you've probably seen the headlines this month that suggest that maybe we only need 1 shot. Maybe 1 shot of Moderna or Pfizer is as effective as the 2. That is not what the clinical trials show us. I'm going to take a second and just sort of break down why those headlines exist. So there are scientists outside of the clinical trials who took a small subset of the data and reanalyzed it. And so they looked at folks who had gotten the vaccine, the Pfizer vaccine, about 2 weeks after they got their first dose, and then followed them for about 1 week until they got their second dose. And they were able to find that the level of protection those folks received in just that 1 week seemed to be similar, just slightly lower than the level of protection the vaccine gave after the second dose. But here's the thing, it doesn't give us any sense as to the long-term effect or the long-term protection that one dose can give. And look, the reason why these vaccines are 2 doses, that the reason why that's the schedule is that in earlier versions of clinical trials, earlier stages, a single dose of the vaccine created a weaker immune response, right? So your immune system didn't rev up the way that it was supposed to or the way that it needed to with just the 1 dose. And so they turned it into a 2-dose vaccine because the response is so much stronger afterwards. So it's really dangerous. These headlines are I think irresponsible, but it's dangerous for us, right, to trust whatever we read. That's why these conversations are so important, to break down the evidence and the science, because what we know is what the clinical trials show us is that 2 doses of the Pfizer vaccine or of the Moderna vaccine create around 95% efficacy or 95% protection from COVID infection with symptoms. And so that's all we can go by. We don't know how effective the 1 dose is going to be in the long run, a month out, 2 months out.
Dr. Kareem, I actually see you shaking your head because I want to say you were part of the Amen Corner when it comes to what Dr. Arnett just said.
I am definitely part of the Amen Corner. I'm often shaking my head to Black women. If sometimes we just sit back and just listen to our Black women leading this charge, we'd be in a much better place. So I'm often in the Amen Corner with that. But to that point, I want to just give you just kind of dispel a couple of myths. And to Dr. Maya's point, I actually got the Pfizer vaccine because she made up a great point. She talked about a great point. Sometimes in healthcare, we'll say, as long as it's what we call evidence-based, you can have treatment A or treatment B. And it's not about is one better than the other. Sometimes it's what do you have access to? And what I had access to at the time was the Pfizer study, was the Pfizer vaccine. And that's why I got the Pfizer vaccine first, because our health institution was not offering the Moderna at that time. And I also want to give a plug for something that people may not actually be expecting us to say. And it's about being an active participant in your healthcare. What do I mean by that? A lot of the way many people are going to get access to this first round of vaccine is being active in their medical records. I find this both and I want to say that this could be a form of disparity and inequity as well, but and I know if I didn't say that, Maya will come after me. So this is a form of both a disparity and inequity as well. But since we have this platform, I want to encourage as many people as possible. If you are a part of a health system, please go into the electronic medical records of that health system, that patient portal, and sign up. I have some friends and family members that say, well, I'm not going to sign up for that because, when you start clicking the information, they have access to your information, they follow you. People, let's not.
They already got access to your information. What are we
Thank you, Ms. Jones.
Here?
Exactly. But the reason why this is so important to our community, Ms. Jones, is because if we do not understand the ways in which the healthcare community is communicating with our patients, we once again will be left behind. That is not me ignoring the digital divide that exists, because I understand that people don't have access to smartphones, people don't have access to broadband and the internet that they need, and we're working on that. But a lot of health systems are communicating with you through emails and through that patient portal. It is not uncommon for people to get an email on a Sunday saying, you are in the category and you are eligible for the vaccine. Can you come in tomorrow? These are the slots we have available. And I don't want us to miss out because of a lack of knowledge. I want us to know that this is the way the healthcare community is communicating with its patients. Now, there's people out there like Dr. Green and I are saying that can't be the only way. You cannot only communicate with them through through email and through the patient portal. We need to go back to those old school ways of picking up the phone, utilizing community health workers. And so I also want to encourage our patients, if you see a number coming across your phone that may be like for us at UIC, if it's a 312-996-2000, that is someone from the Miles Square Health Center calling you to let you know that you might be eligible for the vaccine. So I know a lot of us don't answer unknown numbers, but I just put that out there, Ms. Jones, because that's some of the misinformation that people are not getting. They're saying, well, I didn't even know I was eligible for the vaccine. And if they go through their patient portal, there's an email sitting in that inbox unopened. That shouldn't be the only way we're communicating, but I want to put that out there.
I appreciate that so much, because I am one of those ones guilty of not answering the phone when it's an unknown person. And I don't want to miss out on my blessing. So we want to make sure that you all get that. Dr. Maya, I come to you on this question because I'm going to confess my internist, who has taken care of me for many, many years, who also happens to be one of my best friends, she said to me that the vaccines have gone through such rigorous trials that the long-term impact studies are of such a nature that she felt very confident in taking either one of the vaccines. But she also said to me, Star, if Frito-Lay vaccine had gone through the exact same thing, I'd have taken the Frito-Lay vaccine, okay? It's about making sure you get in that line for the vaccine. Dr. Maya, and I know that's something you 100% are preaching also.
Yes, absolutely. I strongly feel like we have to use in our community all the resources. So one of the resources that I find is very important is our community leaders, right? We have people like I have more people that reached out to their pastor, their worship leader, that person, then called me and said, hey, I wanted the vaccine. Utilizing all of the resources, I think, is very, very, very important to get not only in line for it, but I encourage people, because we got to take care of our elders. What I'm saying is, if you know elders that want the vaccine, collect that information now. Get their information. And when you see these links, help your elders sign up. Help your elders sign up. Let's take responsibility for the village, for each other, and just help each other sign up. Like Dr. Watson said, it can't only be a link. It has to be by phone. Click that. I think we just sent out the City of Chicago vaccine finder. Click that and help each other get the vaccine if we want it.
That please check the chat, everybody, because the vaccine finder for Chicago has been put in this chat. As we disclose additional resources, they will go into the chat for you to just click, cut and paste, so that you can have it for your own resources. Dr. Watson, here's a question that a lot of people want to know. Once I receive both vaccine doses, okay, can I still test positive for COVID?
Yes, you can, and I will also ask my clinicians on the call to weigh in on that. But you still can test positive for COVID. The one of the things we know about the vaccine is when you have to think about what is the research question that the vaccine is looking to address. The research question that the vaccine was looking to address was to decrease morbidity, which is sickness and poor health outcomes, and mortality, which is death. That is what the vaccine, one of the main goals of the vaccine to do. Now, are there hopes that having the vaccine will also prevent you from getting COVID-19? That is the hope, and one of the other questions that we're studying down the line. But I do want to let people know that getting the vaccine, we are not there yet in terms of the vaccine is not a free ticket to go out and stop social distancing, to go out and stop wearing your mask. It's a step in that direction, but it is not a destination. Right? We are still on a journey, and we need to remember that. And I want to, if my clinical colleagues, if Dr. Green or Dr. Arnett have any comments about some of the things that they're seeing, and we can talk about some of the data too about, what I'll come back after they have a chance to respond about what was in the clinical trial. But Dr. Green?
Yeah, definitely. You definitely want to keep like Dr. Watson said, you still got to mask up. Right? You still got to wash those hands, get that thumb. If I see people do this and then just go get the back of that thumb to hit it. And you also want to keep your physical distance. And if you think about it, the purpose of a vaccine is to help us develop an immunity, right? Help our bodies infection soldiers mount up, like Dr. Arnett said, mount up and get ready to fight COVID. So if I go and I take the vaccine and then I test myself to see if I have immunity or I have an antibody against it, the answer is going to be yes. Part of the purpose of the vaccine is to help us develop antibodies. And so after you get the vaccine, if you test your antibodies, the answer is going to be yes. The CDC also has documentation that spoke to this, and I can include that. You know, we're going to include that in the chat box and in the follow up.
Thank you so much, Dr. Arnett. Dr. Green referenced you and the whole Mount Up efforts. The people are concerned that the vaccine is not a one-shot wonder, or even a two-shot wonder is the best way for me to put it. And there's questions on whether or not we might need this vaccine every year, like the flu shot.
Yeah, yeah. So, I mean, to echo what Dr. Watson said, um, the research question that the trials asked was, can we prevent cases of symptomatic COVID? So, infection with symptoms. And they weren't looking to see whether folks had asymptomatic COVID. They weren't testing to see whether folks had COVID-19. They had been infected, but just didn't have symptoms, right? And we remember, especially in the early cases of the pandemic, like that was the fear that folks could be walking around. And this is still a very significant risk that especially young folks and low risk folks can be walking around with COVID-19 infections, not know it, and then pass it on to higher risk folks, their grandparents, their aunties, et cetera. So that risk of asymptomatic COVID just really wasn't tested in either the Pfizer or the Moderna trial. So we still, even after you get the vaccine, you got to be careful to protect yourself and protect others, just like Dr. Green said. So the masking up, the hand washing is really at that point more of a protection for the people and a show of respect and concern and love for the people around you than it is complete protection for you.
That's a very good point, Dr. Arnett, because just so that our viewers understand what you mean, when you say it didn't test for asymptomatic, I want to break that down just so that it can be granular for people. For those people who get or got COVID and were chilling like a villain, they might had a nose run, or they might have felt a little bit achy, but then went right back to work and they were cool. Bless
Yes.
them. We're happy about that. But for the 600,000 who it affected in a way that ended up killing them, that's what the vaccine is designed to prohibit. Okay? The vaccine is not for the chilling like a villain people, the asymptomatic people. It's for those that could end up on that ventilator, for those that could, to stop us from having to end up on that ventilator, to stop us from having to plan another virtual funeral. Am I correct, Dr. Arnett?
Yes, absolutely. So it's most effective in preventing this severe COVID disease, the type that sends you to the hospital, puts you on a ventilator, requires emergent dialysis while you're on a ventilator. Just horrible things are happening to folks with severe COVID infection. But it is really important that all of us, even the lower risk folks, get the vaccine, because that's how we create the sort of herd immunity that protects even the higher risk folks. So higher risk need to get the vaccine so they're less likely to have severe disease. Lower risk need to get the vaccine so they're less likely to have severe disease. And so they're less likely to, so we're less likely to spread the COVID virus around all of us. So we're less likely to kill the people that we love, to put it really bluntly. I mean, it's morbid, but that's what we're talking about here. That's why this is such an important conversation.
Dr. Watson, did you want to weigh in here?
And yeah, I did. And also I want to use this opportunity to weigh in on the importance of diversity in clinical trials. So it's not only important for us to participate in getting the vaccine, but there's still additional research questions that are being asked about the vaccine, about long hauls, about people. So if you get approached about participating in a research study, really consider that. Don't just have that blanket no because of all the justified medical mistrust that does exist. One, we want to acknowledge that it's not that the Black community has this unfounded reason to not have a trust, to have, to have mistrust in the medical community. The medical community has oftentimes earned that mistrust, and we have to do a better job of disrupting that pattern. But I want to encourage us, it's so important. One of the reasons why we know how this vaccine works in people of color is because we were at the table. Not only were we at the table in designing the trial, but this is one of the times when we got it close to right in terms of participation. There's about 43,000 participants in the Pfizer study and about 30,000 participants in the Moderna study. Both of those studies had about 10% underrepresentation of minorities in those studies. And we really did a good job in the Hispanic community, because we had about 26.2% of those participants were Hispanic or Latinx. And we have to do better when thinking about engaging African Americans in trial. Now, we did better in this study than we've ever done typically, because we normally only have about, in the cancer research studies that we do, it's normally about 5% of African Americans participate in those trials, 5%, but yet we carry some of the greatest burdens of disease and the greatest death rates from cancers, but we only participate in 5% of the trials. That's not always our fault. It's not just because we're saying no. Sometimes we're never asked to participate. Many times communities of color get their treatment at community hospitals and FQHCs that are not being asked to be a part of those trials. So we got to disrupt this whole myth that Black people are just saying no to clinical trials. Sometimes we don't even have access to clinical trials. We don't even know that the clinical trials exist. So we have to make sure that we disrupt this myth that Black people just say no. Sometimes it's more about access and awareness than it is about us saying no.
Dr. Maya, I know you completely agree. You can go ahead and unmute yourself, because this is something that you've been preaching for a number of years.
Mm-hmm. Thank you. It is hot. Dr. Arnett, Dr. Watson, I'm loving this conversation. Some of the stuff we mentioned, the reason we have to be in these clinical trials, and we have to, be present and really dig deep about this vaccine and how vaccines work, Dr. Arnett mentioned. Pastor Moss and First Lady Moss, this is your area of healing, so you may have to, help me with this. Growing up, I do remember how in the Bible it talks about, from what because I'm a physician, so I see illness, whether it's mental illness or spiritual illness, lurking through the land, searching to and fro, trying to find somewhere to land. And if this illness, disease, or whatever it is cannot, then it dies off, goes back to where it came. And when we think about, and I try to, put it in context, because when we think about the coronavirus, the reason we're still masking up, the reason we're still washing our hands, the reason that Dr. Arnett said, hey, I might not feel it, but I am transferring, letting it land on me and letting it, move to my grandmother, to and fro. That's how the virus tries to spread, from person to person to person, right? The purpose of the vaccine is to close that door and say, nope, you cannot rest here. You cannot stay here. And I'm washing my hands, because when we do that together, we take the coronavirus out of our community. And that's how that herd immunity that Dr. Arnett was talking about works. And also, being at the table with research, that's the same representation. Nope, Dr. Kizzy's saying, nope, you're going to include my community in this. Nope, you're going to include us in the research. And nope, you're going to include us in the rollout. And so that's why on both ends, research and implementation of the vaccine, we have to be at the table to be the one to say, nope, nope illness, nope racism, you will not rest here.
That is magnificent. Thank you so very much for just that word that you have brought to us today. I also would like to just point out, I am going to move to some rapid fire questions, trying to hit as many questions as I can that people just have that are very specific to them. However, I know that you all are putting some questions in the Q&A. I apologize in advance. We had the registrations where people put in their questions. And so out of courtesy, I'm going to have to take those questions that we've already processed through the registration first, and be respectful of our experts' time. So let's try to get through some of these rapid fire questions. Again, and I'll start with you, Dr. Watson. Will we need a vaccine every year like the flu shot?
Possibly. One of the things I want to make sure people know is that this is science, and as we know more, we get more better information, we do better. So right now, there is a possibility that we may be in a period of time where we have to take this more than just once. This may not be a one and done, as Dr. Arnett has said.
Okay, Dr. Green, what symptoms do you look out for after you've received the vaccine?
Just symptoms that people have the first time they receive. If you think about your kids, what happened? Because it's a novel coronavirus, everybody's a coronavirus baby. So injection site, pain at the injection site, fatigue. Some people have headache, muscle pain. Most of these things resolve after the first 24 hours. And so just put it in your framework. If you have kids, remember when you got them the vaccine, the doctor said, hey, the first 24 hours may be uneasy. So it's the same thing with us.
Dr. Green, I can tell you that I've had to get the flu shot every year, especially since open heart surgery, and my doctors insist. And some years, I have flu-like symptoms for anywhere from 18 to 36 hours. And so what I have learned to do is I get my flu shot on a Thursday evening usually, so that I know I have the weekend in case I'm gonna feel a little sick.
Come on, you brought up something. I'm sorry, go ahead.
No, no, no. I wanted to see if I'm using the right methodology.
You are, and you brought up something else brilliant. We get the flu shot every year. Dr. Kareem Watson just said we might have to get another one. We get the flu shot every year because the flu has variants. So every year we get it, right? So if we see these new variants and if this vaccine doesn't work against these variants, we may have to get another one because just like the flu shot, nothing new under the sun. We've done this before. You get a vaccine against a variant. So with the COVID-19 vaccine, you may have to get one against the variant. And we may have to in the future get a booster, but guess what? We get a booster for the tetanus shot. You've been getting them since you was 15. Don't let misinformation change this for you. All right.
Very smart. Thank you for bringing that point about the variants. Dr. Watson, another rapid fire. If you have heart disease, should you get the vaccine?
If you have a pre-existing condition such as heart disease, MS, or any other conditions of this, you should talk to your physician, your provider, about whether or not that the vaccine is safe for you, and have a conversation about not just about the coronavirus vaccine, but about all vaccines if you have a pre-existing condition. Because what you need to know the difference between sometimes if a vaccine is live or if it's not alive, and what that should do for you. But that conversation should start with a primary healthcare provider if you have a pre-existing condition.
I'm going to give you a good example with me. I take a beta blocker every now and again. I don't need it every day after open heart surgery. But my physician said to me, my inhaler that I use for my asthma, I cannot take them within a certain amount of hours because they're contraindicated. The only way I would know that is I had that specific conversation with the doctor, and my doctor has a list of all the prescriptions that I have, so they'll know which one is contraindicated. So that is a real conversation that you need to have with your doctor to make sure that whatever you're getting, whatever vaccine you're getting, whatever medication you're taking is not contraindicated for anything else that you're going to introduce in your body.
And if I may, Ms. Jones, to comment on that comment you made is so important. Another healthcare community member that we don't utilize enough is our pharmacist. You don't have to have a medical appointment to talk to. When you pick up that prescription and that piece of paper that's on the bag that we normally tear up and hopefully recycle, read that. But also have a conversation with that pharmacist. When it says above that pharmacy technician, where it says, ask, you have questions, ask the pharmacist questions. Say, hey, I just got this new inhaler and I got this new medication. Should I be thinking about, can I take these at the same time? Are there interactions? I have people that tell me all the time, well, Kareem, I believe in the natural way. I believe in taking my green smoothies, which is great. I do too. But sometimes you're taking a green smoothie and you're on a blood thinner. Guess what? You may be doing something that may be counterproductive. So talk to your doctors about things that are natural as well, because our Black community, we like our home remedies, which is part of our history and part of our DNA. But bring that brown bag with everything you've taken from all those medications and all those vitamins, the apple cider vinegar and everything else. Bring that bag to the doctor's office and say, now, real talk, this is what I'm taking for real. Now, is this going to interact with my blood pressure medication? Because I'm taking this because the barbershop, somebody told me they take it and their blood sugars went down. that may not be true. That may not be evidence-based, but bring it to your doctor and have a for real, real talk conversation with them about it.
Pastor Moss, you cracking up because I know we're sitting here laughing that we're having a conversation on whether or not we want to take the vaccine that might save our lives, give herd immunity to our community. But we will pour a half a bottle of apple cider vinegar in some kale juice and blend it together and say, because my cousin told me at the barbershop that this is what worked. Okay, listen to what Dr. Watson just said. Dr. Arnett, I turn to you. Rapid fire. Should pregnant women or breastfeeding women get the vaccine? And how does the vaccine affect infertility? This is your area of expertise.
Okay. First, no evidence to suggest that that either of the vaccines affect infertility. Second, to carry on the emerging theme here, yes, let's make sure that folks are talking to their healthcare providers about whether or not to get the vaccine. The CDC says there's no reason why pregnant or breastfeeding women should not get the vaccine. And what we know about pregnancy and postpartum is that immune systems are a bit weaker. So those women are then at higher risk, and babies who have weak immune systems are at higher risk for contracting COVID-19. And so it's even more important to prevent by vaccinating against COVID-19. So yes, for those categories, and no infertility issues.
Thank you, Dr. Arnett. Dr. Watson, I go back to your area of expertise. How does the vaccine interact with the presence of cancer cells? And what should people with cancer histories know about the vaccines?
So the recurrent theme is that anyone that has a pre-existing condition, and cancer is a pre-existing condition, should again talk to their provider, because cancer survivors on a spectrum, right? Some cancer survivors may have with like a metastatic breast cancer, so they may be in active treatment right now, but on the survivorship role where they're healthy, they have their cancer treatment under control, but you may be still taking a chemotherapy drug, and so you want to talk to your provider, your healthcare provider, and say, is there going to be an interaction between this medication and the vaccine? And so I think we have to what we want people to know is that the question you're asking your doctors is, are there interactions with the vaccine and certain medications? Because when we think about those that are living with cancer, the question becomes, are you on an immunosuppressant drug? Are you on something that may make the side effects of the vaccine not as effective? I mean, the vaccine not as effective in you. And that's why it's so important to talk to that provider before you just sign up for the vaccine. And that provider can be a telehealth visit, you all. That does not mean you have to come into the clinic because you may be trying to social distance. You can pick up the phone, schedule a telehealth visit, and say, I want to talk to my provider about whether or not the vaccine is safe for me. Because when the Pfizer vaccine had people in it, about 35% of participants in the Pfizer vaccine were obese, because we wanted to see how does it look in the regular population. About 8.4% of the people had diabetes, and 7.8% of the population target participants had pulmonary disease. So the study did look at populations that look like the rest of the US, right? But in terms of getting down granular to this particular type of cancer or MS or even pregnancy, we have to do better in terms of research and including women of reproductive age in our research studies, because that's one of the disparities that exist in research, is that we often don't include women of reproductive age in our research studies, because we as a scientific community, we have to get better at how we can ask questions inclusive of other populations.
Okay, Dr. Arnett, I got this question. If you are on dialysis and you take the vaccine, when they clean your blood, will the vaccine also be cleaned out?
Yeah, so good question. Short answer, since this is rapid fire, is no. But long answer is discuss this with your kidney doctor, your nephrologist, who, if you're on dialysis, you should be seeing multiple times a week, since they're managing your dialysis protocol. Talk to your kidney doctor really just about the timing. Folks who are on dialysis, and for the general audience, you all know dialysis is a process that uses a machine outside the body to filter your blood the way that kidneys do. So people who have kidney failure, whose kidneys can no longer filter their blood the way that it should, the dialysis machine pulls the blood out. It filters the blood for electrolytes, proteins, etc. It puts the blood back in back into the body. And sometimes folks with dialysis who have needed IV medications or who've needed to take antibiotics by mouth, they'll know that they've had to talk to their kidney doctor about coordinating the timing of when they take the medication and when they get dialysis. But we give vaccines to patients on dialysis all the time, right? So there's no reason to believe that you shouldn't be able to get the COVID-19 vaccine or that it won't be effective. Um, but it is really important to know folks with chronic kidney disease, again, have that weakened immune system. Folks on dialysis have that weakened immune system. They're in a higher risk category. So the National Kidney Foundation and the CDC, again, recommend that these folks get the vaccine, they get vaccinated against COVID-19.
So that, I think that answer probably applies to MS if you have blood clots. And I heard you say, Dr. Watson, if you're taking immunosuppressant medication, these are the things that you want to have a full conversation with your medical provider. Dr. Green, I'm going to turn to you because I got a couple of questions about people who say they're allergic or sensitive to the quote unknown. And a lot of folk do want to know the ingredients contained in vaccines or in other products to see if it's something that they want to introduce into their body because they may react to it. So I'm going to ask that question that Dr. Watson alluded to, that piece of paper on your prescription that you rip off and throw away. How do you get a detailed list of all the ingredients that have been put into the vaccine?
Absolutely. You're absolutely correct. Just like food and everything else has a list of ingredients on the back of it, these vaccines have a list of ingredients on a website. Now, like we already talked about, telling somebody, oh, just go to the CDC's vaccine, things aren't. That's why I love this conversation. That's why I'm glad that you all have provided a list of resources for people. I'm going to put that link right in there and they can look at the list. Not only do you look at the list and see if you have it, because one of the things about this vaccine, there's a specific, like, so for instance, if I'm the vaccine and I need to be delivered into a person's body, imagine me getting on the bus and the bus is the actual vehicle that's carrying myself into it. There's a list of what carries the vaccine or the vaccine into your body, and you have to look at it. But also when you present to get it, there will be a list there. It's on page 3. Just remember, CDC thing, page 3. And you can ask your provider or the people giving you the vaccine to see it. And I'm going to put that list there because, a lot of times the names are all fancy and, just I'm going to put the list there and the resources and people can get it. Okay.
Thank you, Dr. Green. Pastor Moss, we have 380 people who are here looking and paying attention. So with your permission, I want permission to go a little bit longer so I can get some more of these questions answered. So we're going to go another 30 minutes because the doctors are just so brilliant. I want to make sure that we get as much answered as possible. Okay, so we dealt with MS, we dealt with blood clots, immunosuppressants. Let's do some very practical things. Dr. Maya, how do I sign up to receive the vaccine? I know you put some stuff in the chat. There's some people who are a little cut and paste challenged. So I want to make sure that we get all this information to everybody in a way that they can process it. What are your suggestions?
Definitely. The first thing in our communities that we're finding the best way is to contact your community leader, whether that's your worship leader, contact your church, contact your mosque, contact those spaces. Number one. Number two, the city of Chicago has something called Shy Coach, at CHI Coach Chicago. If you look that up, that is a site that will tell you, it gives you not only where to sign up, how to sign up, it gives you a link. If I'm having symptoms and I'm wondering if I have COVID, you can do that. And then after you get the vaccination, it gives you a link for follow-up after that. So best way to do it, or you can call 311 and they'll link you to the way to sign up.
Oh, see, now that's important, 311. Mm-hmm. Now, I'm going to also suggest you look in the chat Everybody, if you have your cell phone, even if you don't know how to do anything, you know how to take a picture. Take a picture of the chat and give it to your grandson or your son and tell them click on some of these links for me, because you know they have their cell phone connected to their left hand. It's always in the hand, so they can click on it if you can't click on it. We want to make sure that you have access to all this information. Take a picture of the chat if you are cut and paste challenged, so that somebody can just transfer that information for you. Dr. Arnett, do you have any additional suggestions?
Those are excellent. I don't know that I have a ton more to add on how to get vaccinations. Dr. Watson mentioned earlier, make sure you get in touch with your existing health providers. Health systems are reaching out to people right now, so make sure they're aware of you.
Dr. Maya, I've seen a couple of people write in that they've signed up for a few locations and there seem to be no dates available to schedule the vaccine. When will new dates become available? Which, of course, I'm going to turn over to the Mosses also, because we did a fabulous one at Trinity. Okay, so Dr. Green, what you got?
The best way that we're finding out is again, it's the community leaders. That is how important, when we talk about essential personnel, if I tell you these community leaders are coming through for this community, I love it. Contact them. And also, I did put a link and I'll send it again, the phases. So what we're going to see is Chicago put us on phases. So you have to contact that 311 number close to those dates and get those. Also, that Reverend Jasmine, I think, put in the COVID coach, that link I was talking about. That'll tell you all the ways to get it, all the ways that you can find out when it's become available again. The point I want to make before I move on is, just because the city of Chicago has phases does not mean that I should decide that I don't qualify. Please do not disqualify yourself. You call and you say, I want the vaccine, and then you follow that process.
Oh, that's a brilliant suggestion right there. And also, I'd like to let you know that our event producer, Sister Hammond, has just said that they are copying the information that is in this chat and will share with all registered attendees via your email. So if you got your link to get onto our webinar today, you will get a follow-up email, which, by the way, because we are a community, feel free to share that email with anybody that's within your community circle. Think of yourself as a dartboard. You're the center of that dartboard. Who are the concentric circles that go outside of that center? Okay, you want to make sure that your immediate family has the information. Then you want to move to the people that you call your play cousins. Then you want to move to your coworkers and your associates. Just think of yourself as the center of that dartboard and send that information out to as many people as possible. And because I alluded to the fact that I wanted to bring in Sister Moss again, the next few questions are really just practical concerns. And I believe who better to ask them but our own First Lady. And as Pastor Moss said, Monica Brown Moss is a wife, a mother, a food justice advocate, and educator. And that proud graduate of Spelman College and Teachers College, Columbia University. She is one passionate sister about food as nutrition, food as a cultural expression, and food as an agent of community change and transformation. Feeding hungry people is her mission in life. She's also my soror and my dear friend. So I'm going to invite Mrs. Monica Moss back into the discussion to ask the next series of questions. Sister Moss, will you take it from here?
Well, thank you so much, Star. This has been excellent. People are just chiming in saying that they are just getting so much information. So thank you for this thus far. And these questions that I'm about to ask are really just the practical questions. You know, I am a mom, and so I have young adults in my household, and one is old enough to get the vaccine but hasn't, and one is not old enough at this point. So there have been many questions about children that have come in and asking about children. And we'll be in the grocery store and we'll see kids without masks. And so we're wondering, can children be infected and can they spread? And so please, if we could just, I'm going to toss that out to Dr. Arnett, if you could answer that. Thank you.
Yeah, that's an excellent question. So, yes, kids can get COVID-19. Kids of all ages can contract the virus and develop the syndrome. And they're kind of like the silent ticking time bombs because so many kids are likely to be those asymptomatic carriers we talked about who are going to go visit their grandparents, get their high risk family members ill, get, high risk teachers ill. And so, yeah, kids still need to do those social distancing, those masking, those hand washing procedures, um, just as much as adults, if not more so. As hard as that is, right, to get a 7-year-old to wash their hands carefully or to wear their mask all day in school. And sorry, I will add. So there is a lot of discussion about kids being so low risk, but there is a component, there's a segment of children that actually has had severe COVID symptoms, a condition called multi-system inflammatory condition, that's been just really awful for children. It's consisted of lung disease and just an inflammatory surge all over the body. Kids get really, really ill, end up in the hospital, and those do tend to be sort of those older adolescent age children. So it's we can't throw away kids' risk. We can't take it for granted that because they're young and healthy, they're going to be just fine. We still have to be cautious with them.
And so another question that's come in, and I'll toss this one to Dr. Watson, is once you've had the first shot or even both shots, are we contagious to people in our environment? And so could we give it to our children, or could they, that needs to be clarified. And then another really important question came in is, you get Pfizer first, can you get Moderna second? And are they interchangeable?
I'm going to start. Thank you for that, Ms. Ma. I'm going to start with that second question. Are they interchangeable? The answer is no. If you have to make sure that you keep track and keep record of which vaccine you started off with, because if you started off with Pfizer, you need to end with Pfizer. Your first dose should match 100% your second dose. So this is not an opportunity to say, well, I'm gonna see which one that let's let science answer the research questions in a very confined way. So that's the easy answer there, is that whatever vaccine dose you start off with for that first dose needs to match your second dose. Now, to your first question is, and I love for my colleagues to chime in on this, is that one of the misconceptions is that when you get the vaccine, you're getting COVID. That is not the case. This vaccine is meant to spark your immune system. So we've used this term called, spike protein, and we have all these scientific terms that we use. But what we like to think of it is that the vaccine is helping your body to recognize something that may be, to get a memory of something that may be foreign to it, so that when it does see it, it can say, oh, okay, I recognize this. I can mount an immune response to this in order to fight this off. But by no way is the mRNA COVID-19 vaccine a live virus that's getting injected into people for them to mount an immune system that way. So that's the part answer to your question is, so you're not infectious per se. You're not infectious after, once you get the vaccine. But the different conversation to have is that you may still contract COVID-19, after some point of getting the vaccine. And so that's where the question of continuing to maintain that hand washing, including that thumb, masking, and social distancing.
Absolutely. One of the things I quickly say, thank you, Dr. Watson. When people ask me about vaccines and am I getting a COVID, I be like, I usually say, when you eat chicken wings, you're not eating a whole live chicken, you're eating a chicken wing. So when you get a vaccine, you're not getting a whole live virus, you're getting a vaccine. Or in terms of Dr. Arnett or Dr. Terry Mason, if I'm eating an apple, I'm not eating a tree, I'm eating an apple. And so that's how I like to explain what getting the vaccine is versus getting the whole live thing.
Oh, I love it.
Yes.
Brilliant.
Do I have time for 2 more questions?
Go right ahead.
Okay. So the next question that has come in is, it's about food and underlying conditions. We have all heard since this entire coronavirus just started, people started talking about underlying conditions. So we now are very familiar with that. But can you talk a little bit about how nutrition and good food, how does that affect the coronavirus?
Yeah, I'll start. Ms. Moss, I'm so happy with the work that you're doing with the Greater Chicago Food Depository. And one of my mentors, one of your church members, Dr. Terry Mason, he would be, if I didn't mention the toxicities of food we eat, and I think Dr. Mason, I would get a call or a text after this show. And one of the conversations that other food justice advocates like Dr. Mason have been saying is that it's really interesting that people are having this issue with what they're putting into their body as it relates to the vaccine when we eat some foods that we know are toxic for us, that we know are inflammatory causing agents. Now, let's be mindful of why we eat those foods. Sometimes we eat those foods because that's all we have. That's all we have access to. And I don't ever want to make it seem like that our communities are not dealing with food injustices. But this is an opportunity for people to do two things. One, to reimagine your healthcare environment. I want people to take this as an opportunity to get connected with the healthcare system. Whether it's if you don't have insurance, Maya and I both work at federally qualified health systems. We can see you despite your ability to pay. You do not need to have insurance for us to see you. You don't even need to have a social security number for us to be able to see you at our FQHCs. That's one, get connected with healthcare, but also reimagine your nutrition, right? Your food should be your health and your wealth. So start thinking about what you're putting into your body, not just the vaccine, but also in terms of the food. There are foods that you can take that can be natural immune boosters that you can do on top of. But we should be doing that in general anyway, not just during the pandemic, but we should be thinking about reimagining food in general.
Excellent.
Yeah. I'm so sorry. Yeah, Lady Moss, if I could step in for just a second, that really is such an important conversation. I just want to broadcast something. I'm typing into the chat right now. So my company, my digital wellness platform, Bite Wellness, actually has a free course on how to use food and other self-care strategies like adequate sleep to strengthen your immune system. So that's something that's just really important to do, to eat these anti-inflammatory foods that have actually been shown to cut back on inflammation at the molecular level, like in the nucleus, which is really incredible. This is not a substitute for hand washing, masking, social distancing, or the vaccine, but it is important to strengthen our immune systems because our vaccine works by priming our immune systems. So I'm putting the link to this free course in the chat, and hopefully that'll be sent out to folks too.
Fantastic.
Last question. And we all really should know the answer to this, but I think it's really basic. How do we wear a mask properly? And how long will we have to wear masks, even if we have the vaccine? That keeps coming in. People are saying, well, I have to wear this all until the next year even. So please, let's talk about mask wearing. There's Dr. Watson.
That's good. That's good. That's good.
So,
Jones, that's it. And what's the best type of mask? That looks like a KN95. Tell us what the best is.
And so this is one of the things that we learn now. If you're taking off your mask to do it, I'm missing one step. As I take off my mask, I should also be doing some type of hand sanitizing and washing my hands. So don't do it. What I just did needs to be followed up by some hand washing and some hand sanitizing, which I would do in 1 second. But in terms of the mask, one of the things that I'm really want us to disrupt the narrative about is that science, those of us in the scientific community, we know that we get new information every day that changes the way we make decisions. So when this first came out, some people were frustrated because they said, well, you told me I didn't need to wear a mask. Now you tell me I do need to wear one. And I may tell you something different tomorrow that I may learn through science. That's the beauty of science. I may say something different. It's not me being hypocritical. It's me, it's us, it's a scientific community learning. What do we know now? We know if you're a healthcare provider, if you're in active contact with someone and who may be actively impacted by COVID, there's a whole level of personal protection equipment. We hear the term PPE that you need. That's the healthcare community. But if you are an everyday layperson, at the very least, you should be thinking about wearing some type of surgical mask, or if you can get access to it, one of the KN95 masks. We have to be careful to say between N95 versus KN95 KN95 because there's a difference. When you're in the healthcare community, when you're for an N95 mask, that's a whole process. You have to get fit for that mask. You have to go through a certain breathing test to see are you properly protected from that. But as a lay person, if you can get access to a KN95 when you're going to be out doing grocery shopping, that is one of the ones that the CDC does recommend. But they also recommend a surgical mask, which is just the regular mask, which I'll show you another picture of. And now people are saying, well, should I wear 4 masks? Should I wear 5 masks? There has been some new discovery out there that says wearing 2 masks, if you don't have access to a KN95, wearing a surgical mask with a cloth mask over it may cause some increased protection. And there has been some evidence to show that. But we have to just be smart. But the one thing I would say about mask wearing is cover up your nose and your mouth. I felt so bad. This lady was so proud of herself. She had on her mask and she was actually talking to me about wearing her mask and she had it right. Her nose was, I said, before we continue this conversation, I'm gonna need you to pull your mask up and cover your nose, number one. But I'm sure my other colleagues have more answers about mask wearing.
I just like to keep it like easiest for me to remember is I put my mask on behind my ears, over the nose, under the chin, and then boom, like Dr. Watson said, get that hand sanitizer out and clean it. Yep. Also, there's a link that we just put up where it talks about how long you wear the mask in case the information changes. You can use that same link.
Excellent.
Yes.
Wonderful, wonderful, wonderful. Monica, thank you so much for, as I say, practical, real life questions that people are concerned about every single day. As we're starting to wrap up, I have a few questions that are my closing questions. But there was one, Dr. Watson, you just alluded to the fact that science changes all the time. I look at it as continuing learning education. Teachers go back, lawyers go back, doctors go back to learn what else is new. And also environmental changes, what's happening in our society might make the science have to adjust and move and be a little more nimble. For instance, this past week, our country had some pretty devastating weather issues. So there's some questions about how the delays because of weather might affect the second shot. So how might delays of a second shot due to supply shortages, weather-related cancellations, or missed appointments affect the overall effectiveness of the vaccinations? So like if your second dose is postponed, do you have to start from scratch? Everybody wants to know. These are very practical things, but they changed based on what has happened in our society. Dr. Watson?
That is a great question, Ms. Jones. And so we, in public health, we call this emergency response, right? There's most public health, all cities and most rural towns and townships have some type of public health response team. And you may, if you listen to what you hear on a national news channel, you may hear something different than what you hear boots on the ground local in your own community, because your own community's emergency response team is responding based on the resources and information they have. And so they will more than likely come up with a response that says, if you've been impacted by weather, if you've been impacted by the current situations in a lot of our states, and we're keeping our brothers and sisters in Texas and other places in our prayers. But if you've been impacted, pick up the phone if you have access to the phone and say, when can I get my shot next? Because we do not want people starting over from scratch, because that's not how the vaccine was tested. If by chance you get extended out from that 3-week or that time period, have that conversation with that medical team or that public health team in your community. Particularly go to your Department of Health website, or there should be a phone number, and they can tell you about that. And that makes me think too, Ms. Jones, about people are saying, well, Kareem, this was developed so quickly, and all this happened. This is actually encouraging to me, because this shows me what science can do. This shows me what we can do as a scientific community. We have collective intelligence and collective resources. So I don't want the community to use this as an opportunity for mistrust. I want them to use this as an opportunity to say, aha, I now know what you all can do. So I want to see this same efforts and the same amount of agency and advocacy put around nephrologists, put around kidney disease, put around eliminating HIV, put around eliminating cancer, and put around eliminating our food deserts and the toxicities that we have from food. This has shown me what we can do when we're resourced up, not what we can't do. So I'm encouraged as a scientist.
Oh, Pastor Moss, Dr. Watson trying to preach up here today. He just decided to bring the word for a minute. You all listen to what he said. It's not about what you can't do anymore. We now know what you can do. So we're going to hold your feet to the fire. To the medical panel, the president is saying that everyone will be vaccinated by July 2021. I'm keeping Uncle Joe in prayer, and Auntie Kamala 100%. So is this a realistic timeline? Because we want them to be as successful because it's all going to benefit us. Is this a realistic timeline, Dr. Maya?
Um, we've seen it. We've seen the results of what we can do, like Dr. Watson said, when we band together. It will be, I believe it will be realistic if we start to do what we're doing now, which is access the community leaders, right? And so I think a lot of times when we say these things and throw them out there, we don't take into account we have to communicate on all levels of brilliant channels. So the Latino community, the African American community, young people may not communicate along these CDC guidelines and things like that. So if we realize that this is a disease where one community cannot heal without the other, then we can do it. And so the challenge is to heal together, because when we beat it together. Every time we fail to beat it, we fail together, you know? So.
Fantastic, fantastic. Mrs. Moss, how soon is Trinity gonna host another round of vaccine shots? Because I know our community wants to know that.
Absolutely. So we were very fortunate to partner with Howard Brown Health. Last Saturday, the 13th, the day before Thanksgiving, we gave Valentine's, we were able to give a
It's Thanksgiving Day.
yeah, it is a Thanksgiving Day. But we were able to give a big love gift to the community because of Howard Brown Health. And so we gave over 400 vaccinations to the community. Now, we will have a follow-up on March 13th for those who received their vaccines on February 13th. They will come back on March 13th. But we have not scheduled again because what we learned from that experience is that this is a huge lift. It takes a lot of coordination to make sure we can do it effectively and that we are really serving the community in its best way. So we will be in conversation with Howard Brown Health again to see if we could do this in the future. But I think someone said earlier I think Dr. Green said there are so many churches now who are getting on board and who want to be able to get these vaccines to their own church congregations and surrounding communities. So just be on the lookout and listen out because we will definitely let you know if we're able to do it again soon.
Fantastic. Thank you so much. I have put all the resources in the chat. And again, our producer, Sister Hammond, has already told me that she has gathered all of the notes. And Dr. Green is like me. She is the organizer. We like to be poly planner. So she is going to have a resource document that's going to be sent to our producers, and then that will be forwarded to everyone who has registered today. So, Pastor Moss, I saw that there were 400 people on at one time, and so all of those people will in fact receive a follow-up with your resources so that you have access to everything that we have talked about today. As a final question, I'd like to ask the entire medical panel, if there's one thing that you can say to everyone regarding this vaccine, what would you like to leave everyone with? I'm an advocate for the vaccine because the alternative is not one that I want to consider for myself, my family, or my community. I made that evaluation with the help of my doctors, the people who already saved my life when they performed open heart surgery. So I depend on them. And I want people who are listening and watching what we've talked about today to have that kind of relationship with their medical provider also. But for those who don't, what can you say to them today to sort of take them away from the hype of what the media has said that Black folk don't want this vaccine and put them into the mode of, let me talk to the people who care about me, my family, my medical professional? Dr. Arnett, I'll start with you.
Sure. Thank you for that question, Ms. Jones. So this is really a time for us, like Dr. Watson said, to focus on what we can do collectively. So, so many of our discussions about this vaccine, I think, bring us back to the power that each of us individually has to affect the collective, to improve the lives of those around us we love and those around us we barely recognize that we touched, right? So thinking about each of us taking the vaccine as a way to uplift our entire community, as a way to show love during what has been one of the most difficult times that most of us alive in the world have recognized, a consistent year within the pandemic after so much loss. What an opportunity to come together and reaffirm our collective value and our commitment to each other, by thinking through the incredible risk of death from COVID-19 and balancing that, weighing that out against the benefit that comes from taking the vaccine. That's what I'd bring us back to, outside of ourselves and back to the collective.
Thank you so much, Dr. Arnett. Dr. Watson, what's the
Thank
one
you.
thing?
The one thing is to there's I'm often this vaccine conversation, this conversation of vaccine hesitancy. I often tell people I'm not here to actually try to change minds. I'm actually here to get you access and information. And no matter where you sit on the vaccine hesitancy, whether you say I'm not ready, I'm not going to get it, or I'm ready, I don't have access, one message I want to leave you with is get a relationship with the healthcare community. Become an active participant in your own healthcare. That means finding a provider. I know that there are doctors out there that look like you, that think like you, and can have those real conversations like we're having. Dr. Maya is open to accepting new patients. I'm sure Dr. Arnett is open to possibly accepting new patients. We have people here at Miles Square that look and think like Dr. Green that will have new patients that I trust my own healthcare with and the healthcare of my family members. So no matter where you sit, we did not want to change your mind today. We wanted to get you access and awareness and information. But please, the one thing I can say is get a relationship with a healthcare provider. Just like we always say, get a covering, get a pastor, get a medical covering, get a relationship with the healthcare community.
That's such excellent, excellent advice. And Dr. Maya, the conversation has been for several months now amongst members of our community. We're going to let the white people get it first. We're going to wait and let the white people get it first. Well, I saw the numbers. 79% of the vaccine that has been distributed thus far has been to our Caucasian brothers and sisters. So if that's what your plan of action was, that's already happened. Dr. Meyer, what's the one thing you'd like to leave us with?
I like to say, hey, when I hear we'll let white people get it first, I'll be like, oh, that's interesting because they're not dying first. They're not dying first of COVID. At the end of the day, we have to protect our tribe. We have to protect our tribe. And if getting the vaccine is going to help me to not spread it to my elders, to my children, to my loved ones, to my partners, we're going to have to do that. And the only way we can do that is continue to have conversations like this. Like I said, our community is brilliant. We're not here to like Dr. Watson said, educate them on everything. We've been educated by history. We're brilliant, so brilliant. We're still in this country and thriving in spite of the things that have been done to us. So now it's time to protect our tribe. If we've never seen in history before something that challenges and encourages our ability to move as a unit, it is this pandemic. It is time to move as a unit. It's time to protect your tribe. Mask up, clean your hands, stand up for your community. And when it's time to get your vaccine, if it's you, step up.
Well, Dr. Green has just given us the word. Dr. Arnett, Dr. Watson, Dr. Green, I really want to thank you for your participation today. Ladies and gentlemen who have been a part of our audience, we hope we've answered your most pressing questions and that now you feel empowered to make smart and informed health decisions for you and your family regarding the COVID vaccine. That has been the goal today, so that to inform you so you can make decisions that work for you. And I'd like to thank Pastor and Mrs. Moss for allowing us the platform to inform our community. Your continued work within the community is really a godsend. So, for our final word today, let me bring back our esteemed pastor and leader, Dr. Otis Moss III. Pastor Moss, turning it
Thank
back
you
over to you.
so much, Star. You've done a tremendous job as moderator, and we want to thank you because some people don't know that moderating is work,
Yes.
preparation and work, and you do an exceptional job. To our panelists, Dr. Green, Dr. Watson, Dr. Arnett, thank you. This has been informative. This has been inspiring, and to witness your excitement and passion around these issues. It just excites me knowing that we have people of your expertise who are in our community, who are concerned about the health and well-being of our community. A few quick announcements. I want to let everyone know that we are going to rebroadcast this for our Wednesday at the Well. So on Wednesday evening, this will be broadcast. This will be Bible study for Wednesday. The Bible study scripture will be, you will know the truth and the truth will set you free. So if you know the truth about COVID-19, we can overcome it. And also know the truth about COVID-19, which deepens the crisis around COVID-19. For those who have some hesitancy in reference to this entire crisis that we are going through, you will encounter people who will share misinformation. I want to give you something to respond to those individuals, because you'll be at the barbershop, the salon, you'll be wherever. Simply ask them, are you a medical professional? Just ask that question. Are you a medical professional? If they say no, then they said, I need to get my information from a medical professional. The second thing they will say is, I did my research. Hold up. Google ain't research, all right? Twitter is not research. Facebook is not research. We live in an age where people have access to information, but they don't have access to wisdom. Do not confuse information with wisdom. And we received wisdom today from people who are medical experts. So please utilize that as we prepare to go from this place. Ask them, are you a medical professional? So you can stop the conversation, so we can stop the spread of a social disease of misinformation that is hurting our community. Again, I want to thank everyone and all those who are behind the scenes who've been doing the work, and everyone that has been working through the chat. We thank you so very much. And again, to our panel, you all were magnificent. To our moderator, we thank you for your professionalism. You were exquisite. And of course, to my partner right next to me, the one and the only Miss Monica Brown Moss, who did her thing today. So we thank all of you. Let's have a word of prayer as we depart from this place. Lord, we thank you for this information, this inspiration, and the passion and the truth that has set us free today. May we be evangelists for appropriate information, that we may save lives, that we may come through this period as a much stronger and better people. We thank you, we love you, and we magnify your holy name. In the mighty and wonderful name of Jesus, we pray, and the people of God who love God may say, amen.
Amen.